Hi, my name is Angela, and I am making this video to talk about my clinical experiences and how I met the clinical objectives in my Nursing 435 leadership course at Cedar Crest College. So, for objective number one, we had to apply knowledge from previous courses in the physical and social sciences, humanities, and nursing in meeting the different needs of individuals. So I did this through my peer leadership hours. I had to complete 16 of them. I did them in a variety of places. So for 4 hours, I did 2 separate sessions of peer tutoring. I worked with the new cohort of ABSNs at the college, and we worked on basic knowledge in pharmacology of what they were learning in that specific week. I taught them how to make a drug card to learn all the drugs for their exams. We went over organizational skills to have as a student at Cedar Crest, and just tips and tricks for success in the program, being someone who now is almost through it. I also did the skills workshop for Nursing 431, which was the complex wound care, the drain management, and the residual limb care. That was really cool. I got to teach students how to do each of those skills, and it was a good refresher for me because I hadn't done them since my own skills recording. So that was really cool. And then I also got to spend a 10-hour day at Lehigh Valley Health Network Muhlenberg Hospital on the behavioral health unit with the part-time nursing students. So this was to fulfill their mental health clinical day. And I helped mentor them on therapeutic communication with the patients on the unit. We helped kind of show them how to pull information from the patients in a respectful manner, and what kind of like a mental health assessment looks like there for the different types of patients and their different disease processes. We talked about psychiatric medications. We talked about care plans, and I showed them how to make a proper SBAR. So it was a really good day there, and I enjoyed my experience a lot. And then objective number two was to apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. I did this through my nurse supervisor hours. I went to Lehigh Valley Health Network, Cedar Crest Hospital, and I got to spend an 8-hour evening shift, the 3 to 11, with a couple different nurse supervisors. We walked around just about every part of the hospital and just answered calls to whatever unit needed it. So we solved a lot of patient-nurse disputes, any disputes on the unit between staff. We also helped out with clinical skills, so things like IVs needed, or if a nurse was overloaded with a bunch of patients and needed help just grabbing vitals on one, or questions regarding documentation, we were able to answer. So that was cool. I would say their main job responsibility for the hours that I were there, other than helping in clinical areas, was to apply like planning and staffing abilities within their assigned units to meet the management needs of the particular units. But yeah, ethically, you just had to settle patient and staffing disputes. It wasn't necessary to get the ethics committee involved. We were able to just use therapeutic communication and the different styles of leadership management. So, for example, we found it more helpful to be authoritative rather than taking a laissez-faire approach for some situations. So yeah, by just using the different styles of leadership management and keeping ethics like beneficence and non-maleficence in mind, we were able to solve disputes and help out on the units. And then objective three was to evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So I did this, I felt like, in every experience, because you had to communicate professionally, like from with students to other students, or me as a student to my nurse preceptor, or myself as a student to a CEO that I was paired with that day, or a supervisor, a nurse practitioner. But I would say the main form of communication that I used throughout the entire clinical experience was kind of through emails. So I sent introductory emails stating, myself as a student, who I am, where I attend my school, and kind of what my role is in this clinical experience, what I was attending that specific site for. And then I also sent thank you emails after every experience, and I would state things that I learned at the end of each experience in the email. So, for example, the one day I went to Trinity Soup Kitchen as a part of my community hours, and I learned that they don't just sell soup at a soup kitchen, surprisingly. It's all different types of meals. It's multiple times a day. It is 7 days a week at the particular soup kitchen that I went to. And I also got to learn about other homeless shelters in the area that I could provide the community members that came to the soup kitchen information as to how to access those homelessness resources, other soup kitchens in the area, and things like that. So I thought that was awesome. But yeah, overall in these emails, I used a lot of closed loop communication. So when I would send out an introductory email and they would say, okay, we're expecting you on this date to come to this area to work with this person to do this task, I would say, okay, great. Thank you so much for confirming. I will meet you at that date, at that time with this person, so on and so forth. And that's huge in nursing, closed loop communication, especially during high stressful situations in the clinical setting. So for objective number 4, we had to critically analyze and integrate leadership research findings into the total plan of care for a group of patients. I was able to do this through my research article, which I will present in my dissemination at a later time. But the research article I found was titled, Analyzing the Role of the PICU Nurse to Guide Education of New Graduate Nurses. I thought this was super fitting because 1, I am a new graduate nurse in just a couple weeks, and 2, I will be starting a position in the PICU. So this was a study that was conducted in 2 different countries, and it looked at the effectiveness of new grad residency programs in different areas of the PICU. So it looked at 3 main areas: the patient population, the clinical activities that nurses do in the PICU, and the level of independence that they have or that they require doing these activities. So the results showed that cardiac and respiratory patients require the most knowledge of clinical expertise and level of independence of that new grad nurse. And it showed that these new grad nurse residency programs yielded better outcomes, better patient outcomes. There was less patient deaths, there were less med errors, and the new grad nurses themselves had a higher satisfactory rating when asked by professionals what they thought of their new grad nurse residency program. So yeah, I thought that was super fitting for not just me going into the PICU, but all my classmates being new grad nurses. And I'm excited because Lehigh Valley has a nurse residency program that all of my classmates and I will be a part of, as well as St. Luke's. So for objective number 5, we had to apply principles of ethics, advocacy, and teaching to the everyday care of patients. So I did this through 2 different clinical experiences. My one was through the political and legislative hours. So my class and I went to Harrisburg, Capitol Hill, for a day in May, and we advocated for the Patient Safety Act, which basically strives to establish safe staffing ratios in PA hospitals. So we spoke directly to a PA governor. We talked about personal experience in clinical. So for example, I almost had a med error in one of my clinicals, and that was not because I was incompetent as a student nurse, or I didn't know my medication, or I didn't understand why I was giving it. It happened because I was paired with a nurse who had 9 patients that day, and when you have 9 patients, that can be anywhere from 10 to 50 medications during a med pass. And this has to happen within a certain time frame for all of these patients. So it gets very stressful and it's very easy to make a mistake. And luckily, we were able to catch it before we administered the medication to the patient. But that's just one of the many struggles that nurses deal with because we don't have safe staffing ratios, especially in areas of higher acuity. So we were able to communicate our own personal clinical experiences to the governors and voice our opinions on why we should have the Patient Safety Act enacted. So that was really cool. And then through my community hours, I got to be a part of the type 1 diabetes camp at Mayfair at Cedar Crest College. I taught people that attended Mayfair about type 1 diabetes with my other classmates. We did this through playing games like Jeopardy and handing out prizes if they answered questions about type 1 diabetes correctly. So I really exercised the teaching aspect of this objective here. Objective number 6, you had to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing. I did this through continuing education hours. I watched Nurse Blake CNE courses where I actually gained CNE credits. I gained 6 hours of credits. So I watched 3 different videos. One was PICU allergic reactions. Another was IBS in pediatrics. And the third was hypoplastic left heart syndrome in pediatrics. And this kind of prepared me better for things I might see in practice in the PICU and will help to enhance my knowledge. I might feel a little bit more confident going into a patient situation or patient assignment, knowing more of this knowledge of specific pediatric things. And then objective number 7 was to recognize the role of the nurse in policymaking related to healthcare services at all levels. Again, I did this at my political leadership hours on my day at Capitol Hill. My class and I researched the success of California hospitals passing the Senate Bill 227, which is the Patient Safety Act. We found that there were better, not only patient outcomes, but nursing outcomes. Less of a turnover in staff. Nurses rated higher satisfaction at their jobs and at their hospitals, having now this law in place. So we talked directly to PSNA members and government officials about our research findings of this in hopes that making this personal connection would kind of sway their opinions and beliefs to enact this law. And I overall just learned how important it is for nurses to push for changes in local laws. We really do have a say. It starts with one voice, but there's power in numbers. So joining things like nursing unions and stuff can be extremely beneficial to the community and to patients as well. Then objective number 8, I had to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I did this during my advanced practice role. I worked with Deanie Rivera. She is a professor at Cedar Crest College that I had for my mental health clinical. She's also a certified registered psychiatric nurse practitioner. She works at Comprehensive Health Services at Lehigh Valley 17th Street Hospital, and she provides psychiatric services for HIV positive patients. And this was a really cool experience because this is such a delicate population. It's really sensitive. So we kept in mind the ANA Code of Ethics provision 3.1, which talks about HIPAA and the importance of patient confidentiality. Extremely important here in this case with this demographic of patients, because they are not required to disclose to any outside people about their HIV status. We had to deal with an ethical dilemma related to patient autonomy. A patient wanted to discontinue a medication that Professor Rivera did not feel was appropriate, but ultimately we honored the patient's wishes and we discontinued that med. So yeah, I hope you enjoyed hearing about my clinical experiences as much as I did having them. Thank you for watching.